Connecting TPN to a PICC. These procedures have been developed from current evidence in order to preserve vascular access and prevent infections and occlusions. When you are performing line care, an aseptic technique should be followed precisely at all times. Take the TPN bag out of the fridge 1 to 2 hours before administration. Ensure it is prescribed on the drug chart. 2 registered nurses should then check the constituents of the TPN bag against the blue TPN chart. Check the bag for any leaks or visible particles. Ensure that the bag is covered to protect the contents from light. Check patient ID and gain consent. In order to connect your patient to their TPN via their PICC, you will need the following items: a trolley and large Clinell universal wipes, a dressing pack, 2 × 10 ml sodium chloride posiflushes, 1 pair sterile gloves, 4 small Clinell wipes, 1 IV giving set, 1 TPN filter, 1 IV volumetric pump, alcohol gel, 1 apron. Once your equipment is gathered, gel your hands and place some large Clinell wipes on the trolley. Wash your hands fully using infection control procedures for hand decontamination. Use the large Clinell wipes to firmly clean over each surface using an S-shaped movement from top to bottom only once. Allow trolley to dry. Put apron on. In order to keep the dressing pack sterile, open the packaging without touching the insides and drop it onto the trolley. As you are about to touch a sterile item, alcohol gel your hands. Create a sterile field by opening the dressing pack using only the corners. You can now open the rest of the equipment, placing them onto the sterile field. Use a Clinell wipe to clean the giving port on the feed and remove the port cap using the wipe. Discard the cap and Clinell wipe and allow port to air dry. Now expose the PICC line. Assess the line site for any signs of infection. Look at the Radiology Care Plan Welsh Clinical Portal for the insertion measurement and then observe the PICC measurements on the line. Count from 0 inwards towards the body. Each white dot is 1 centimetre. The insertion measurement should also be stated on the top of the surveillance form. If the line has displaced by more than 2 centimetres from the insertion measurement, do not use the line and promptly ask your nutrition nurse or ward doctor for advice. A full hand wash is now required. Now dry your hands thoroughly and put on your sterile gloves. Open up your small wipes and sterile drape to make them easily accessible. Hold a wipe in each hand. Use one wipe to hold up the line, use the other to clean down the line, including the clamp, and remove swab cap. Only touch the line with the wipes. Discard wipe and cap. Use a clean Clinell wipe to clean the end of the needle-free device. Scrub the hub for 15 seconds and allow to dry. Keeping the line elevated, place the sterile drape over the arm. The line can now be dropped onto the sterile drape. Discard the Clinell wipe. Pick up the first PICC. Expel airlock in syringe and then attach to the needle-free device. Unclamp the line. Pull back to obtain a flashback of blood. This shows you that the PICC is in a vein. If no flashback, flush a couple of mils of saline and try again. If still unable to obtain flashback, consult nutrition nurse medical team before using the line. If blood flashback is successfully obtained, using a PICC, flush the line using a push-pause technique. As the last 1 mil is being flushed, close the line clamp to provide positive pressure. Discard syringe. Flush again with a further 10 mil PICC and then discard syringe. Attach the short end of the filter to the IV giving set. Hold the giving port with gauze and insert the giving set into the feed. Prime the giving set. Make sure any air is expelled by letting it run through the line. Clamp the giving set. Remove the end cap of the giving set and connect to the needle-free device. Remove your gloves, gel your hands. Thread the giving set into the pump and program volume over time as per prescription. Unclamp the line and start the infusion. Discard waste and wash your hands. Complete fluid balance and surveillance charts. If you need to access more than one lumen of the PICC during the same procedure, please clean each lumen separately.